Greetings, everyone. My name is Willysha Jenkins, current database manager and trained health disparity information scientist working at the State Center for Health Statistics. I'm so happy to share this presentation with you entitled Data Equity, Reinventing Data Practices and Culture. Recently, we've all borne witness to acts of domestic terrorism caught on film. We have seen the disparate outcomes and impacts of the pandemic on various populations. And these realities have really forcibly removed the blinders from all of our eyes. And we're now in the necessary space of communal thinking and discussion, as well as collaboration. People of different backgrounds, belief systems, cultures, different areas of expertise have all come together to begin to dissect the institution of structural and systematic racism, oppression, and social justice. From the topics of education, healthcare and healthcare access, employment opportunities, wealth accumulation, and policing practices, all of these institutions that create a society are being re-examined through the lens of anti-racism and equity. Data in and of itself and the systems that create it and rely upon it have been no exception in this new journey. So, what is data equity? Data equity is really the premise that the manner in which we collect data, analyze it, interpret it, and disseminate it should be equity centered and equity focused. We all know that knowledge is power, and every decision that's made in our society is powered by some sort of data. So, data equity is extremely important as it forces us to reflect on how we can use or how we commonly may use data to reinforce stereotypes or exacerbate complex and inherent biases through data misrepresentation. It makes us think about ways we can enable data sovereignty and create dynamic ways of data democratization. It also allows us to reflect and think about how harmful decision making is often justified and maintained through data misuse. So, why does this tend to happen? Why do we see this happening? And it's really because of the current culture. I have a friend that works for a governmental agency, and I was just speaking to her about where she was in her work and talking about equity. And she mentioned this project, the National COVID Cohort Collaborative. And this is a project where they're looking to see the impacts of COVID-19 on persons suffering from COPD. And she was expressing her concerns about their research design, as all participants were only able to participate if they were able to reach a specific hospital or clinic to engage in the study. We all know that Black women have been deemed most at risk for COPD, with a diagnosis rate 7% higher than both white males and females. However, despite this, the sampling strategy for this work was not necessarily equitable, as the communities they want to reach may not have access to transportation, or if they do, it may not reach that particular clinic or hospital, or even when it comes to employment, may not have the flexibility to participate. So these things aren't necessarily based on inherent racism, but it speaks to the current data practices and how equity is not always the center, whether it's conscious or subconscious. So in our current data culture, that's really, as I was mentioning on the previous slide, that's what contributes to this issue. And the current data culture is heavily rooted in historical practices and precedents. Data coverage and collection protocols will reflect the priorities of whatever organization, whatever entity, whatever policies and institutions are conducting that particular research effort. The lack of representation of underrepresented populations or historically marginalized populations and communities in biomedical and public health research and work is a present day issue that has a lot of historical origins associated with mistrust and racial practices that have been executed upon certain groups in the area of medicine for centuries. We see in the current data culture that the voice of those in need is often muted or not really considered in the practices of research design the methods of collection, outcomes, and intervention. Oftentimes, when we are presenting data or participating in data, we use deficit framing versus asset framing mindsets and language. Deficit framing really perpetuates a stigma and a narrow narrative that the people that we are trying to collect information on or address in whatever particular research effort are often the victims, and there's nothing to contribute. And it's important to change that culture and use data that speaks to people's aspirations and the asset that they can be to society should these disparities and inequities be addressed successfully. For example, Black Americans have been noted to be one of the most likely demographics to serve in the military and in various civilian roles. That Black Americans generally have a higher rate of charitable giving, especially when it comes to our belief systems and volunteerism and other groups. And the same goes for a lot of historically marginalized groups, as we have historical connections that contribute to our cultures. Data equity requires us to use this to expand our narrative beyond the victimization, beyond the deficit framing, and reduce the stigma about using resources in the communities that need it most, in the communities that are facing injustice. Oftentimes in the data culture, we see institution versus the individuals. So with structural racism, we often it gets individualized, putting both the blame and burden of improvement on the individuals rather than solely putting it on the racist structures and institutions that have created this situation that they are forced to live in. We see inadequate data governance. This goes beyond laws and regulations and data headline grabbing data breaches and all the things you may see in the news. Data governance really includes ongoing behind the scenes decision making about who's allowed to access and use data and for what purpose are they seeking to do this. We tend to see bias. And really, to address bias in data, we really need to acknowledge and address the bias. That bias can cause real harm. It's not some mute point that, it's a part of our lives, but it doesn't have an effect. We see the harm that bias can create in the criminal justice system, in the healthcare system, with disparate maternal mortality rates, for instance. With new AI facial recognition software and things of that nature, and in many other places. And it's important that we acknowledge that bias exists. So as we move towards a more automated world and data-driven world, that we understand that the precedents and the historical data that we use to generate this new world is founded on bias, and it's something that needs to be addressed. We often see in the data culture as well that there's a lack of humility in understanding that we are dealing with individuals, not just numbers. So, how do we combat the status quo? How do we really move to make a difference and ensure we see equity throughout the data lifecycle? We have to understand that all this begins with funding. Money makes the world go round. That's a fact, but so does data, right? So, where are the resources from these projects coming from? That will show you a lot about the motivation of the work. Is the research area verbose? Or are there many people doing the same thing? How the project is paid for will also often show you where the equity lies in the initiative. Okay. Next, motivation. They're often hidden or secondary agendas in everything that we do. Having a research project where the motivation is clearly stated and you can evaluate that through the impact of your project, that's something that really needs to be considered and something that needs to be in the forefront of your minds and of the conversation before the project or research initiative is even started or data collection even begins. Project design. Ensuring that your structuring methodology of the data project, um, ensuring that that is equitable is a challenge, because there can be many pitfalls and issues when you're trying to create a research design or project design that is equitable. Generally, with equitable methodology, it takes a collaborative team, a diverse team of people with lived experiences, collaborating with experts to create a research or project design, if this is community based, that really reaches the populations that is meant to reach in an effective way. Changing the way we look at or addressing equity in the data collection and sourcing cycle portion of the data cycle. So requirements for equitable data collection are very complex. Sample selection is extremely important, but so is survey design. The behavior of the collector or the cultural experience of the collector in the community in which they are trying to collect information from. Scope and scale, um, cultural and language translation, various collection mediums. Are they equitable? Are we able to tap into populations with varying education, varying digital expertise or digital literacy? We have to make sure we understand that data corruption is possible. And really think about these things and really have that as address those pitfalls or potential pitfalls in our design as we look into our sampling frames and our sourcing of data. In the analysis, even highly trained analysts can be given the same exact data and come up with different results. And a lot of times these different results are very much, correct. They're just different. Differences in approaches. That is how this happens. Because statistical methodology that you use and the variables that you choose to include or exclude from a model can affect the outcomes that are disseminated or interpreted from the same exact data set. So it doesn't necessarily mean it's correct, but it really shows that in your variable selection, the questions you choose to ask often contribute to the outcomes or the interpretation that you see as it pertains to a certain research project and the data that's collected in that project. Interpretation. Data is really not useful if you don't have people who can really interpret and share the story. And oftentimes our stories, just like in everyday life, when we're thinking about data, is dictated by our own inherent biases. So, data in and of itself doesn't have any type of intrinsic meaning. So we give meaning to what we see. Assumptions, because of our biases about causality, about correlation, expectation, and other relevant factors, can be flawed due to our biases. So that's something we must keep in the forefront of our minds. Communication is extremely important, and considering equitable communication and comms modalities is extremely important. How are you going to tell people about your information? Strategies for communication and persuading and explaining your data can often be askew from reality. So, at the very core of a narrative that you're trying to frame, you must remember that equity is important and you must use equity to contextualize your information. Once you've settled in on a particular interpretation of results, it's important in the data life cycle that you think about the bigger picture. Okay, what are the assumptions of our intended readers? All too often, there's cultural assumptions that are made that there'll be particular understandings inherently, which is not always the case. Assumptions that there'll be a level of understanding as it pertains to um, a particular figure or how someone will interpret a data visual, which is not always the case. Assume that certain vocabulary and that there's concept awareness for the people that will be coming in contact with your data is often something that is missed at this point in the data lifecycle, and something that we must always keep in the forefront of our mind and be cognizant of. You can't assume that your audience will speak like you, think like you, recognize all the same examples the way you would recognize and relate to them. So when you think about those things, you begin to create more effective pedagogies and arguments, and are able to communicate um, data in a more universal and inclusive way. With all this being said, When we're interacting with data, we must stay vigilant and vigilant and always ask ourselves, how or will these data perpetuate or shift power dynamics? We can do that by asking ourselves a series of questions and asking our colleagues a series of questions. Why are we collecting these data? Who is empowered to collect these data? What is the dynamic between the question asker versus the question answerer? Okay, is this a person assumed to be an authoritative figure, someone who is not necessarily trusted or a part of the community? Or is the person asking the questions a comrade, someone looked at as a colleague or a familiar or familiar figure? Who will be the end user of these data? Who wants the data and for what purpose? Who and what will the data be in service to? Is this for to increase sales for some pharmaceutical company or give insight to uh, what other methods or what people are buying or what people need or what people are doing, which in turn can lead to further exploitation of that group? Or will these data be used to really understand and comprehend the true needs of the community and be used to power and fuel effective interventions and disseminate funds and resources to entities within the community that can effect that change with the right motivation? Who are the experts, quote unquote, in the data project? Is it solely people outside of the community? Or is it people with lived experiences being included, or are people with lived experiences and connections being included in the data project with as much input and insight allotted as one deemed a trained expert in whatever field or area? So I want you all to keep in mind that with data equity, we can really transform the nation and we can also really transform the world. We have the power through data to improve community health, to advance economic mobility, and to reduce or eliminate persistent poverty in certain communities and populations. It truly starts with you and I. It's something that we must keep at the forefront of our mind in whatever area of work we work in, whatever uh, project we're a part of, whatever we do. We should always evaluate our individual practices. Ask ourselves, how are we bringing data equity to the work that we are doing? How can the professional and social sectors that I navigate through do better when it comes to addressing inequitable power dynamics as it pertains to projects, as it pertains to office culture, as it pertains to anything you're involved with when it comes to data collection? Are these things being sustained by irresponsible data collection, irresponsible data use? Okay, examine your own biases. I love, I think there is an inherent bias test that is available free online through Harvard University. And this is something that I like to do annually. Even as a woman of color, I know that there are certain stereotypes and inherent biases that I have. And I like to keep those things at the forefront of my mind and make sure I have them in mind so that in my work I can know, okay, if I'm really dogged on this point, do any of my biases contribute to my opinion, contribute to the way in which I'm interpreting these data, contribute to the way I'm addressing this issue or approaching this project? Preempt your bias when you're interacting with data at any level. Always keep it at the forefront of your mind and always set your intentions from the start. Why am I doing this work? Why do I want to get involved? Why is this important to me? And why, do I want to help or impact these communities? And am I aligning myself with persons that are like-minded? It's always super important to remember that it's more than just numbers. It's humanity we're talking about. These are people, these are individuals who were brought into this world with their parents in love, who have families and people that look up to them, that need them, that rely upon them. It's not just a numbers game. And once we are able to truly get back to our humanity in our personal lives and in our work, then anytime we interact with data, anytime we seek to share information, it will come from the true human perspective. Thank you so much for your time. Thank you so much for listening to this presentation. And if you have any questions, comments, concerns, feel free to reach out to me directly. Willysha.Jenkins, that's Willysha.Jenkins at dhhs.nc.gov. Thank you for your time and consideration.